After receiving the diagnosis, it is important to obtain sufficient information about available therapy offers. The therapy offered should be based on the individual symptom severity and the associated impairment. The title therapist is not protected in Germany. Basically, any person may call themselves a therapist. Pay attention to the qualifications of therapists and check whether the institution offers evidence-based interventions. Therapists should have a recognized degree with a specialization and additional qualifications in autism. The term evidence-based interventions refers to those interventions that have been scientifically proven to be effective. Various forms of therapy are distinguished between specific and non-specific procedures. Autism-specific therapies are interventions adapted to autism symptoms. Autism-specific behavior therapy, or ABT, is an example of a specific procedure and can be seen as an overall concept, but there are also individual methods based on ABT, such as treatment and education of autistic and related communication handicapped children, or TEACH, picture exchange communication system, or PECS, as well as developmental, individual differences, relationship-based model, DIR, or floor time. In contrast to specific procedures, non-specific therapy procedures do not affect autism-specific symptomatology. However, they can be used simultaneously for general developmental support and for the treatment of other disorders and comorbidities. Examples of non-specific procedures are logopedics and ergotherapy, remedial education, as well as sensory integration therapy. Note that offers whose evidence has not been scientifically proven are usually ethically indefensible and can directly or indirectly harm children's health. Therefore, you should urgently refrain from alleged therapy approaches such as dolphin therapy, nutrition modification, aided communication, and restraint therapy. The effectiveness of ABT has been scientifically proven. It is therefore an evidence-based, autism-specific therapy intervention. In particular, it aims to teach daily living, practical life, and socio-emotional skills. These include language, social skills, independence, and imitation. Behavioral excesses, or behaviors that occur to a very high degree and prevent the child from actively engaging with their environment and/or are dangerous to oneself or others, are to be reduced with the help of ABT, and constructive alternatives are to be built up. Behavioral deficits, namely behaviors that occur at an insufficient level but are necessary for a self-determined and independent life, can be built up with the help of ABT. Implementing ABT as an early intervention for young children, namely 2 years and older, can significantly improve development and independence. Even in adulthood, ABT can still be supportive in improving quality of life. ABT is based on behavioral therapy. It is reliant on the theoretical foundations of learning, namely every behavior can be learned, unlearned, or relearned. The procedures and methods are based on all autism-specific variants of the learning, psychological, behavioral, therapeutic repertoire. ABT focuses on targeting the potential of each child. The aim is to enable the autistic child to understand their environment and fellow human beings, and to be integrated as well as possible into everyday life. The child's environment must be structured in a way that allows learning in it, from parents, therapists, and peers. The child will be helped to build behaviors that are essential for learning other skills, and to reduce behaviors that limit integration into the community and the acquisition of new skills. With the help of ABT, the child can expand their entire behavioral repertoire and learn to engage in social contact, communicate appropriately, and develop understanding and management of emotions. The earlier ABT is used, the more successful the results will be. The basic principles of ABT are structured learning situations and a structured daily routine, making learning fun for the child, exercises adapted to the child's developmental level, building up desirable behavior and reducing disruptive behavior, systematic approach, and learning situations. We will now briefly discuss the previously mentioned individual methods based on ABT. The basic principles of TEACH are consideration of current knowledge about autism, assistance tailored to the individual case, cooperation with parents and families, inclusion of different evidence-based methods, and a holistic view. Additional principles are support based on a diagnostic that aims to understand the child's or adult's behavior, building on strengths, behavioral control by attempting to make rules of behavior comprehensible, and a procedure based on concepts of developmental psychology and cognitive behavioral therapy. The objective of TEACH is the greatest possible independence and maximization of the quality of life for people with autism. Very individual paths are taken to enable those affected to lead meaningful and independent lives. For further immersion in the topic, we recommend the book Der Teach-Ansatz zur Förderung von Menschen mit Autismus, Einführung in Theorie und Praxis by Anne Häusler. To promote the initiation of communication, Bondi and Frost developed the Nonverbal Picture Exchange Communication System, or PECS, in the 1980s, which is based on behavioral therapy methods and proceeds in 6 phases. Phase 1 is about how to communicate. Namely, individuals learn to exchange single pictures for items or activities they really want. Phase 2 is about distance and persistence. Still using single pictures, individuals learn to generalize this new skill by using it in different places, with different people, and across distances. They are also taught to be more persistent communicators. Phase 3 is about picture discrimination. Namely, individuals learn to select from 2 or more pictures to ask for their favorite things. These are placed in a PECS communication book, which is a ringed binder with self-adhesive hook fastener strips, where pictures are stored and easily removed for communication. Phase 4 is about sentence structure. Namely, individuals learn to construct simple sentences on a detachable sentence strip, using an I want picture followed by a picture of the item being requested. A follow-up of this is attributes and language expansion. Namely, individuals learn to expand their sentences by adding adjectives, verbs, and prepositions. Phase 5 is about responsive requesting. Namely, individuals learn to use PECS to answer questions such as, what do you want? Phase 6 is about commenting. Namely, individuals are taught to comment in response to questions such as, what do you see? What do you hear? And what is it? They learn to make up sentences starting with I see, I hear, I feel, it is etc. The developmental individual difference relationship based, DER or floor time approach, after Greenspan and Vida, uses primarily naturalistic learning situations and is adapted to the child's developmental level. DER or floor time has 6 basic principles, namely share and regulate attention, bond, affective reciprocity and gestural communication, sharing complex social pre-symbolic communication and problem solving, symbolic and creative use of ideas as well as if play and pragmatic language, and logical and abstract use of ideas and thinking, including expressing and reflecting on feelings, finding insight into one's own and others' behavior, and thinking.